Hello, my name is Amber and I'm an RN student at Lock Haven University. I'm going to be doing an example of a head to toe physical assessment today. So the first thing you're going to do is hand hygiene. You want to make your patient aware that they have the right to privacy. She was already made aware that she's has the right, but she agreed to let me post this video, thankfully enough. And then you want to kind of give them a general description of what you're doing. So I'm going to be doing a head-to-toe assessment on you. We're just going to look at basically everything you have to offer. So the first thing you can tell when you walk in the room to see your patient is their general appearance. So she's a middle-aged female. We're going to call her T for the duration of this. You can see that she's well perfused. Her face isn't flushed or too red. Her posture is equal and she's symmetrical. So those are all good signs. And then the next thing you want to check is her mental status. So do you know where you are?
Home.
And do you know what month it is?
December.
And do you know your name?
T.
Okay. So this patient in particular is alert and oriented ×3. She's oriented to the date, she's oriented to the place, and she's oriented to herself. So that's a good thing. Okay, so the next thing we would normally do would be height, weight. However, I do not have a scale, nor do I have a tape measure. So what we're going to do is go on to vitals. However, if I did have a scale and I did have a tape measure, that's how we would do this. Obviously, on the scale, feet together, arms at the side. Same thing with the height. Feet together, arms at the side. Measure from her heel of her feet to the top of her head. So, but we don't have that, so we're going to move on. The first thing I'm going to do is take her temperature, and I have an infrared thermometer here. And what you do with this is you just kind of point it at the body, mostly the forehead, and it'll tell me what her temperature is, okay? Okay, so hers is 97.2. I don't know if you can see that. The next thing you want to do is you can either do pulse or blood pressure, but I'm going to do blood pressure. So we got 112/68, which is good. The next thing I'm going to check is her pulse and respirations. Now, when I check pulse and respirations, I always check them together. That way the patient doesn't realize I'm checking her pulse and respirations and doesn't try to, change the rate of her respirations. So I'm going to look over this way because there's a clock over here, and I'm just going to get her pulse. pulse, I got 100 even, and for her respirations, I got 18. And how I did that was I did 30 seconds of pulse and 30 seconds of respiration, and I multiplied each of them by 2. So that's how I got that number. The first thing I'm going to do is I'm going to do hair, skin, nails. Okay. So do you have any lesions anywhere?
No.
Okay. I'd check that out anyways. But to save time, we're just gonna ask her. I'd check her nails, but as you can see, they're done. So I can't really get to her regular nail anyway. An interesting thing I was showing the other night is if you look at the palms of the hands and they're not pink, that could be a sign of anemia. So that was interesting. But I'm going to check the hair here. The skin is warm, moist. I mean, not hot, not super wet, but it's warm, moist. I check the skin turgor, but she does not want this to be taken off. But all you do is you lightly pinch the right below the clavicle and count how long it takes for the tenting to go down. So the first thing I'm going to check is the hair here, and it's clean. There's no infestations that I can see. Obviously, I'd do a deeper check if I was actually checking head to toe assessment. She has a full head of hair, and her scalp is, it's clear. It's not dry, so that's good. I am going to check capillary refill, however, but I'm going to check it on her toes because her fingernails are done. So the way you check capillary refill is, just going to put this down here for a second. You push down on the nail until it begins to blanch, and then you release, and if it turns pink again within 2 seconds, that means that you have good capillary refill, which she does. Okay, so the next thing we're going to do is her eyes, and for that I'm just going to check her 6 cardinal field of vision. Now, usually it starts off with the Snellen chart. However, I do not have one here, so we're going to skip that. But I'd have her stand 20 feet away, cover one eye, cover the other, leave both uncovered, and that's how we get her visual acuity. But since we don't have that, we're going to start with the cardinal field of gaze. So what I'm going to have you do is I'm just going to have you follow my pen light, and we're going to go just wherever it goes. And I'm just going to look for any nystagmus, or what they call lid lag, which means that your iris is below the level of your eyelid, and I can actually see white between it, okay? So, and that test came out good. Another thing I'm going to check is I'm just going to check her pupillary reflex and accommodation. So usually you dim the room for that. I have my pen light here. So I'm just going to go in from one side and then the other and just watch how her pupils react. And that was good. And then you want to check accommodation. So the way you do that is you take the pen light and you move it towards her face, and if her pupils constrict, then that's a good thing. Which hers did. The pupils also constricted when the light was shined on them. So the next thing we're going to do is we're going to test her peripheral vision. So I'm just going to stand up for me. I'm just going to have you cover your right eye. And we're just going to I'm just gonna have you look at my finger when it comes in. Not actually look at it, but just tell me when you can see it in your field of vision, when you're looking straight at me, okay?
Now. Now. Now.
Good. Okay, other side.
Now.
Okay.
Now.
Okay.
Now.
Okay, good. So her peripheral vision was good. Then something else I'd always check on it whenever you're checking the eyes is you just want to look at the conjunctiva and the sclera, the eyelids, eyebrows. Just want to check for any signs of any infection, any drainage, anything like that. So the next thing I'm going to look at is the ears. Oh, for the eyes, I also use an ophthalmoscope to look at the retina in the back and see the vessels and the optic disc back there. But anyway, back to the ears. You'd usually use an otoscope to look at the inside of the tympanic membrane, which is supposed to be gray pearl color and it's translucent. But I don't have one of those, so we're not going to do that. But you want to look at and palpate the pinna and the tragus and just make sure that there's no sign, it's not really hot, circulation is adequate, and you just want to make sure that there's no lumps or anything in them, which hers were good. Another thing you could do is the Rhine test, which I don't have a tuning fork, but you'd hit the tuning fork, put it behind the ear, and once you couldn't hear it anymore, pull it out to the side and see if she could hear it longer, which if she could, that's great. You'd want to do that bilaterally. The other thing you could do is hit the tuning fork, put it on top of her head. It's called the Weber test, and then if she can hear it equally in both ears, that means there's no conduction issues. But if she cannot, that would mean that there was a conduction issue. The next thing I'm going to do is the mouth. So you just want to inspect the inside of the mouth. Look at the mucosal membranes and the teeth and the tongue. So if you can just open your mouth for me, and everything's pink. When the tongue's nice and pink, it's not cracked. There's no signs of dehydration there. Teeth look fine. Make sure that your patient has a dentist. Is always a good thing. The next thing I'm going to do is the head, which I'm going to palpate the top of the scalp. I just want to make sure that those cranial bones are symmetrical and that all the processes on it are symmetrical, which hers are. So that's great. Another thing I'm going to check is for jaw tenderness. So if you can just open your mouth. Okay, and close it. One more time. Okay, close it. Anything hurt there?
Nope.
Okay, so there was no clicking, no popping, no pain. So that's a good sign. Next thing I'm going to do is the neck. So you want to inspect the neck first. There's no obvious swelling here, no lesions, nothing like that. So I'm just going to feel here for her lymph nodes, which are not enlarged, which is good. I'm going to make sure her trachea is midline, which is, and then I'm going to feel her thyroid. So I'm just going to push it to the side using my right hand and palpate with my left. Hers is swollen, however, she does have a history of thyroid issues. And then you want to do it the other way, which I just did. Push with the left, feel with the right. Okay, so the next thing I'm going to do is I'd usually take a look at her thoracic cavity. However, due to privacy reasons, she does not want to take off the gown, which is okay. So I'm just going to palpate here I'm gonna feel her ribs. Do you feel any pain there?
No.
Feel this side. I can still check for chest rise symmetry. I did that when I was looking at the respirations earlier, so I'm not going to do that again. However, I am going to listen to her lungs on the back side since she did not want me to remove the gown on the front. You always want to go either left, right, right, left. Just make sure you're going back and forth so you can compare the two lungs because it might give you a better clue if there's diminished breath sounds in one or the other. Deep breath for me. And again. And one more. Okay. So her lungs were clear. There was no abnormal sounds there. I did realize I forgot to look at the nose whenever we were looking at the head. So you want to just check the septum, which hers is a little bit deviated. And you just want to check for symmetry. I'm going to palpate your sinuses, okay?
Mm-hmm.
Any pain, any
No.
pressure? No. Okay. And then I'd take the otoscope and look up her nose to check her blood vessels and such, but I don't have one, so I'm not going to be able to do that. The next thing I'd like to do is, well, we're not going to actually look at it, but I'm going to talk about it a little bit, would be the breasts and the reproductive organs. Normally with the breasts, you'd look at the skin color, the areola size and color. You'd palpate to see if there was lumps, and you'd make sure you palpated the axillary lymph nodes. Now, I'm not going to do any of that for privacy purposes here. However, if it was a real situation, I would. I am going to teach you, though, about some breast exams. So you want to start at the center of your breast, and you just want to do circles and press the whole way around and get wider circles and wider circles, checking for lumps. And you want to do that either in the shower or directly after the shower, okay?
Okay.
So the next thing I'm going to do is I'm just going to listen to her heart here. Normally, I'd show you, but I cannot. But we're going to listen to her apical pulse here, where the S1 is, and then we're going to go down here and listen to the S2, which is in the fifth intercostal space of the midclavicular line here. So we're just going to listen. What?
I'm good. I'm ready.
Okay. And so my patient is obviously laughing, but that's how I would get the apical pulse. I'd count for 30 seconds, multiply it by 2, or I could count for the whole 60. If it's an infant, you want to listen for the whole 60 and count. I'm also going to go to the S2, S1 and S2 were both audible from up there, but I'm just going to listen down here anyway. And S2 is very prominent there. No S3s or 4s or extra gallops or anything. No murmurs, anything like that. I'm going to listen to her carotid, arteries for Bruy. So for that, I'm going to use the small side of my stethoscope, and I'm just going to listen in 3 different spots here on bilaterally on each side of her neck. Now, although I could not hear a Bruy because it's a little bit hard to find, I could hear her pulse in her carotid. So the next thing we're going to do is the abdomen. I can't really lay her down because there's construction going on where we're at. So we're just going to have to do the best we can. But the first thing I'm just going to do is I'm just going to inspect. I'm just going to look at the abdomen, make sure there's no lesions and such, make sure it's symmetrical. Now I'm going to auscultate the abdomen to listen for bowel sounds in all 4 quadrants. Which she does have vowel sounds in all 4 quadrants, so that's a good sign. I'm now going to just do some light and deep palpation here. So just tell me if you feel any pain or anything, okay?
Okay. Nothing.
This is just the deep palpation. Nope. Nothing there?
Nope.
Okay. So when I pushed up on your right upper quadrant, if you would have inhaled and held it, it's called an inhalation arrest. That would have told me that you may have had a gallbladder issue. I'm going to check for rebound tenderness, which is a sign of appendicitis. Okay.
Okay.
Anything there?
Nope.
Okay. So that's a good sign there. The next thing I'm just going to check is her peripheral vascular system. So I usually do a capillary refill there, but that doesn't really need to be done because I already did it. So I'm going to do check for varicose veins and check for hair and just feel for her pedal pulses here, okay? That one's present. I need your other sock off. Hair present on both legs. Some varicose veins from what I can see. Probable pedal pulses on both feet. I'm just going to check both arms here now. And those are both equal as well. So, and the next thing we're going to do is range of motion. Now, I would usually do range of motion on every joint in the body. However, due to lack of time, we're only going to do the neck and the shoulders. So for the neck, I'm going to have you lean your head to the left and lean your head to the right. And is there any pain with that?
No.
Okay. Now I'm just going to have you lean your head forward and backwards. Any pain with that?
No.
Okay, I'm just going to have you turn your head to the left and turn your head to the right. Okay, so that showed nothing really. There was no popping. She said she didn't have any pain. So that's good. So I'm going to have you stand up. The next thing we're going to do is the shoulder. So I'm going to have you bring your arms back. Hyperextend. There you go. Is there any pain with that?
No.
Okay, and now I'm just going to have you turn your hand and put the back of your hand against your back. And look for internal rotation. And is there any pain with that?
No.
No. Okay, so I'm going to put your arms down at your sides, and I'm going to have you lift them up to your head. Nope, your arms up to your head.
Oh.
The whole way up. Any pain there?
No.
Okay, and back down. Okay. And we're just going to do one more. I'm just going to have you take your hands and put your hands behind your head. Any pain there?
No.
Okay. So that was all normal. We did internal rotation. You're going to see internal rotation, external rotation, adduction, abduction, hyperextension for those. So the only thing left to do here is the neuro assessment. Now we did her orientation, which she was alert and oriented ×3. We are not going. We usually do cranial nerves. We're not going to do cranial nerve number 1, which is the olfactory, and that has. So for that, you have them close one nostril and inhale an unknown smell and see if they can tell you what that smell was for both nostrils. The second one is the optic nerve, which we already took care of. We would have done the visual acuity test, which we did not do. 3, 4, and 6, we checked when we did the fields, the cardinal fields. 5, I can do here, and it's just gonna be, I'm gonna have her clench her jaw, and that's both equal on both sides. So that's how you check for 5. 7, I'm just gonna have you, it's a facial nerve, and I'm just gonna have you make some face expressions. So I'm gonna have you smile, I'm gonna have you frown, close your eyes really tight for me, don't let me open them. Okay, show me your teeth. Okay, so that was equal on both sides. Not really seeing anything there. For 8, I'm going to do the whisper test, which I actually forgot to do earlier when I did the ear. So I'm going to have you cover one ear, and I'm going to give you a random letters and numbers here, okay? And I'm just going to have you repeat them back to me.
K58.
Okay, and I'm going to go to this side.
353.
Okay, so she passed that one pretty well. The next thing we're going to do is the glossopharyngeal. I'm not actually going to do it. I don't have a tongue blade. But what I do is I put the tongue blade down, have her say ah, and when she said ah, I'd see her uvula and her palate rise then. The spinal nerve is just, processes. So I'm just going to have you push your feet on my hands here as hard as you can. Okay, and back up. Okay, and that's the spinal nerve for 11. And for 12, I'm going to have her stick her tongue out and see if I can see any tremors or if it goes off to the side, which hers goes out straight, which is a good thing. So the next thing we do is her reflexes. So I'm going to start with her. I don't have a reflex hammer, but I'm just going to kind of show you where you would do these at. So here I pull back on the tendons, and I would hit her just right below the patella here. And what should happen is her knee should extend, okay? And that should happen bilaterally. For the Achilles, I'd have to have her lay down. I'd have the hip external, and I'd have her knee flexed, and I'd grab her ankle and I'd hit her right on the Achilles tendon there. And what should happen is the foot should press against my hand then. So for the biceps reflex, I push her on the bicep with my thumb, the tendon, and I hit it. And what should happen is, well, I'd actually hold her arm like this when I did it. So what should happen is her arm should extend there. For the tricep, I'd have her hold, I need your arm dead.
Oh, dead.
And I'd hold it like this. We'd hit the tricep and it would extend that way. So that's my head to toe assessment. Hope you enjoyed. Thank you.